So everyone who comes into clinical psychology, no matter the degree, master's, doctorate, psychiatrist, whatever, is here because they care about people, blah, blah, blah. And so it is meaningful existentially and personally to some degree. However, if a large source of your meaning is from your clinical work, then something is wrong, in my opinion. And the reason I believe that is because, number one, if a large chunk of your meaning comes from your clinical work with other people, that means that those relationships with those ill people means more than other relationships in your life. And that's not okay. My experience of supervising interns is I want you to have the healthiest possible life outside of your professional world. Healthy family, friends, romantic partner, hobbies, physical health routines like exercise and sleep and food and diet and all these things. Because if you're doing the job correctly, in my opinion at least, you're taking care of all the personal things that keep you sane so you can be the best possible clinician. And so if you're not taking care of your sanity outside of work and you're making work more important than your sanity, then you're a shitty clinician. And it's that simple. You are too focused on saving people. Maybe you have this narcissistic hero complex where it's like, I'm saving my patients, which most private practice therapists aren't saving anything, just so we're clear. They're helping people, but they're not working in acute crisis management care like people like myself and others work in. So let's be clear that, like, if you have some kind of God complex especially a private practice therapist where you're like saving people, you got some work to do. You've got some narcissism or something that you're not addressing. But secondarily, if the work is more important than other personal things, then your priorities are screwed up. And it's that simple. Because if you're not taking the best possible care of yourself, and I don't mean you shouldn't work hard and care about your patients and bust your ass to be smarter and more ethical and better at managing your countertransference, I think you should invest all sorts of time in becoming the best possible clinician and knowing as much as you need to know, training, supervision, all of that. I think you should really work hard to be the best possible therapist, but part of that is taking extremely good care of yourself. Because the more screwed up you are, the more you're going to screw up your patients.